How does FRAX assess osteoporosis fracture risk in men and women? Imagine having a simple tool that helps doctors predict your chances of breaking a bone in the next decade. That tool is called FRAX, or Fracture Risk Assessment Tool. It is designed to give a personalized estimate of fracture risk by looking at various factors that influence bone health. FRAX is used for both men and women, especially those over 50, because as we age, the risk of fractures naturally increases. Women, especially after menopause, tend to have higher fracture risks due to hormonal changes that weaken bones. Men usually have higher peak bone mass, but their risk also rises with age and other health issues. FRAX works by combining several pieces of information. First, it asks about clinical risk factors that are easy to identify. These include whether you've had a previous fragility fracture, which is a fracture caused by a minor fall or injury. It also considers if your parents had a hip fracture, as this suggests a genetic predisposition. The tool checks if you smoke currently, use systemic steroids like prednisone, or drink 3 or more units of alcohol daily. It also asks about conditions like rheumatoid arthritis or other causes of secondary osteoporosis, such as untreated hyperthyroidism or long-standing diabetes. Next, FRAX takes into account your age, sex, and body mass index, which is a measure of body fat based on height and weight. Including sex is crucial because women generally have higher fracture risks, especially after menopause, but men are not exempt. The tool can also incorporate bone mineral density measurements from a dual-energy X-ray absorptiometry scan, specifically at the femoral neck. Including this data makes the risk estimate more precise, but FRAX can still work without it if BMD data isn't available. The calculations are based on country-specific data, which means the tool uses different risk models depending on where you live. This accounts for variations in fracture rates and mortality across populations, making the risk estimates more accurate for each individual. After inputting all this information, FRAX provides 2 percentages: the chance of having a hip fracture in the next 10 years and the chance of experiencing any major osteoporotic fracture, which includes fractures of the spine, forearm, hip, or shoulder. Healthcare providers often use these percentages to decide if treatment is necessary. For example, if your 10-year risk of a hip fracture is 3% or higher, or your risk of any major fracture reaches 20% or more, your doctor might recommend preventive measures. These thresholds can vary depending on local guidelines, but they serve as useful benchmarks. In terms of gender differences, FRAX adjusts its calculations based on sex because men and women have different baseline risks. Women, especially after menopause, experience rapid bone loss due to hormonal changes, making them more prone to fractures. Men tend to have stronger bones overall, but as they age and accumulate other risk factors, their fracture risk increases. By including sex as a variable, FRAX provides a tailored risk estimate for each person, whether male or female. In summary, FRAX assesses osteoporosis fracture risk by combining clinical risk factors, demographic data, and optionally bone mineral density. It offers a personalized 10-year fracture probability that helps doctors identify who might benefit from preventive strategies. Remember, these are estimates based on population data and individual factors, so always consult a healthcare professional for personalized advice. This tool is a valuable part of osteoporosis management, aiming to reduce fractures and improve quality of life for both men and women.